I'm Tiffany, and this is Julie from Kingsbrook Animal Hospital.
This is my dog Sullivan, and today he's going to show us just how easy it is to save a life.
He's going to donate his blood.
Sullivan, and he's going to donate blood today. And what we're going to do with him first is just check him over and make sure that he's in good health and happy and ready to give blood. So what we do a couple of things. It's a little bit warm today, so we're going to pay really careful attention to make sure he's nice and hydrated. So we check his gum color, make sure he's nice and pink and his refill time is good. I'm just going to feel him all over, make sure all of his lymph nodes are normal, so that nothing feels unusual. That would tell us that he had some sort of an infection, but he feels good. So, next thing we're going to do is just have a little listen to his heart and lungs. That sounds good. So he looks like he's ready to donate. He's nice and healthy and he's eager for treats, so I think he's ready to go. This looks like a very funny hold, but it actually just kind of helps hold him a little bit steady. So what I'm going to do next is I'm going to find our little spot where we take our blood from on his neck, and I'm going to shave it up a little bit, and I'm going to just give it a little scrub to get it clean. So the scrub we use is the same as you'd use before surgery. So we use a little bit of scrub and then a little bit of alcohol. We do this a couple times to make sure it's nice and clean. Alright. Now I'm just going to hold his little vein off. And I'm going to put the needle in. Just going to tap it, distracts him a little bit so he doesn't feel it so much. So he did really well. He didn't even really notice, which is good. And now all he has to do is lay here for about 2 to 3 minutes that it takes for him to donate blood. So while he donates, I'm just going to watch him. I'm watching my scale, which tells me how much blood I've taken, so I know how much to take. And I actually can feel his heart rate and feel his pulses, and I also check his gum color and make sure that he stays nice and pink. And that's because he can't tell me if he's starting to feel a little bit faint or a little bit funny, so I'll just kind of watch him and make sure that everything seems to be good. He's donated several times before, so he's pretty much a pro at it. Okay, so Sully is done. He just donated a half a pint of blood. Here we go. So what I'm going to do is I'm going to clamp my tube off, and Chris here is going to hold him. And now he's got to stay still for another couple of minutes to clot. But that blood that he donated is actually going to go to, say, 4 other dogs. It's going to get divided up, and it goes to things like puppies with parvo and dogs that have been hit by cars or need big surgeries. Go for it. Alright, so we're done. Good job, Sully. You ready to come down? Oh, you want a belly rub first? Alright, big guy. You want to come down and get some treats? Come here. So we're just going to get Sully down. Although he's not ready to come. He wants to stay. Come here, Sully. Alright, buddy. So, down you go. We're going to put a little wrap on his neck. And everything looks good. We just do this because of his breed. He's got a little bit of higher blood pressure than most dogs. So we just put a little vet wrap around his neck. And then he's good to go. Good job, buddy. There we go. You ready for some treats, Sully?